Our next presenter is Jenifer Rowray, who is presenting on bringing stillbirth to light, advocating for inclusion in federal funding.
Thank you for joining this important presentation, Bringing Stillbirth to Light, Advocating for Inclusion in Federal Funding. We are grateful to Arizona State University's College of Health Solutions for organizing this virtual conference and inviting us to present. My name is Jen Rowray, and I am the Director of Advocacy and Engagement for the National 50c3 nonprofit Healthy Birthday, Inc., whose mission is to improve birth outcomes through programming, advocacy, and research. We help save babies using the evidence-based Count the Kicks stillbirth prevention program.
And my name is Shawn Soumilas. I have been the Arizona ambassador for Count the Kicks since 2013. I'm also a family advisor for the Perinatal and Infant Mortality Task Force with ADHS. The beautiful boy in the picture on the left is my son, Zach, who was stillborn at full term in 2010. Throughout my pregnancy with Zach, I raised numerous concerns that were consistently dismissed. 2 days before my son's death, I reported to my provider that he wasn't moving as much. Despite this, I was assured that everything was okay and that he was simply settling down for birth. On July 3rd, 2010, Zach was stillborn due to a complete hidden placental abruption. I lost 3 times my blood volume and went into disseminated intravascular coagulation, which led to multiple organ dysfunction. The picture on the right is the first time I held Zach in the ICU after coming out of surgery, and my family being told that I had less than a 20% chance of survival. 14 years ago at this time, I was planning Zach's nursery, and I should be planning an upcoming 14th birthday party. There will never be birthdays to celebrate with Zach and milestones like driving a car, graduating high school, or witnessing him start a family. I'm sharing my story with you today because while there's been progress in raising awareness about stillbirth, we must continue to amplify our voices if we truly want to tackle this crisis and prevent future generations from enduring such profound loss.
Unfortunately, tragic stories like Shawn and Zach's are far too common. Stillbirth, which is defined by the CDC as the death of a baby at 20 plus weeks gestation, occurs in every 1 in 175 pregnancies in the United States. Over 21,000 babies are stillborn every year in the U.S. That's 60 babies on average a day. No pregnancy is immune, and stillbirth occurs to women of all races, ethnicities, income levels, and ages.
In viewing this slide, it's clear that there are vast differences in the stillbirth rate affecting Black, Indigenous, Native Hawaiian, and Pacific Islander families. These disparities exist and persist and need to be addressed through systems change. In our effort to prevent stillbirth, we can also save moms. According to one study, more than 15% of maternal deaths within days of delivery occur in women who experience a stillbirth. Research shows that the risk of severe maternal morbidity is more than 4 times higher among stillbirth deliveries compared with live births. I can attest to this firsthand, having been a severe maternal morbidity case and being left with lifelong health consequences. Looking closer at Arizona, the rate of fetal mortality is 6.7, with 527 fetal losses noted in the data in 2021. It's important to note that according to the Arizona Department of Health Services, Black and Indigenous families in Arizona face 2 times the risk of stillbirth over white families.
Despite its significant impact on families, healthcare systems, and communities, stillbirth remains primarily overlooked in federal maternal health funding opportunities. The absence of stillbirth prevention initiatives within Title V funding, the largest mechanism for maternal health funding in the United States, reflects a systemic failure to prioritize this critical issue and properly leverage existing funding. Recognizing the need for action, our organization, the primary stakeholder of the Maternal and Child Health Stillbirth Prevention Act, is addressing this gap by advocating for inclusion of stillbirth prevention activities in federal funding mechanisms. The Maternal and Child Health Stillbirth Prevention Act was introduced in Congress in July of 2023. We appreciate the bipartisan support by our co-sponsors in both the House and Senate. To understand the need for this legislation, we first must understand more about the Title V block grant and why it's important to the issue of stillbirth. In 2022, the Title V grant impacted 93% of, or nearly 3.5 million pregnant women in the United States. But to date, funding is not being properly leveraged to prevent stillbirth, as fewer than 20 states or territories are using any of their Title V block grant dollars on stillbirth prevention activities, leaving American families unnecessarily vulnerable to preventable stillbirth. Of the over $2.6 billion currently available to states in the Title V block grant, it is estimated that less than $1 million is being used on stillbirth prevention nationwide. This bipartisan bill is a simple technical fix to the existing Title V block grant legislation that adds the word stillbirth prevention.
We need Congress to provide clarity and a call to action to state health departments across the U.S. that they can and should be using their Title V block grant dollars towards stillbirth prevention programming. We know that stillbirth prevention has a tremendous return on investment. Research shows as many as 1 in 4 stillbirths may be preventable. That is approximately 5,250 babies' lives per year. Stillbirth is a bipartisan issue. Therefore, this bill is receiving overwhelmingly support from both sides of the aisle. We are hopeful that this bill will become law this year, as it unanimously passed the U.S. Senate last September and recently passed out of the full House Energy and Commerce Committee and is awaiting a vote to pass the U.S. House of Representatives.
The progress in stillbirth prevention is a result of a community of advocates educating, informing, and pushing for change. In fact, Representative Anna Isho calls advocates the oxygen for change. Let's take a look at some examples of advocacy in action.
My name is Brad. I live in Missouri, and my first son was stillborn in 2020.
I remember going home with my husband and Googling, what do you call a baby that dies at 28 weeks? That is the first time I was introduced to the term stillbirth.
2 weeks before my planned induction, I collapsed at home and was rushed to the hospital, where we were told emotionlessly by hospital staff our only son, Jace, would be born still.
Ava, stillborn, January 30th, 2014.
I rise today in support of my bipartisan bill to recognize today as National Stillbirth Prevention Day. There are 21,000 babies born stillborn in the U.S. each year, and the way I see it, that's 21,000 too many. 1 in 4 stillbirths are preventable. Every baby lost to stillbirth is a heartbreak that we can prevent. But amidst this grief, there is hope.
The oxygen of all of these efforts, you move the needle every day, every month, every year in all of these efforts.
Advocacy is a living process and oftentimes requires the ability to pivot and reevaluate strategies. Our organization employs a multifaceted approach in raising awareness and advocating for policy change. Through targeted outreach efforts such as using advocacy software, hosting virtual and in-person meetings with lawmakers, and building strategic partnerships with endorsing organizations and beyond, we aim to garner support for stillbirth prevention initiatives and encourage allocating funds towards research and evidence-based practices. All of these strategies in combination have generated enough momentum to see true movement towards change, but the most impactful strategy is the use of storytelling, whether it is in legislative meetings, written op-eds, TV news stories, or even as a part of an award-winning series on stillbirth by ProPublica. What moves people into action is hearing the lived experiences of advocates.
Since our organization, Healthy Birthday Inc.'s advocacy initiative for federal legislation began, over 14,000 stillbirth advocates have engaged with our Voters' Voice software. 47 national organizations have endorsed the Maternal and Child Health Stillbirth Prevention Act, including ACOG and ANCHIP. We have hosted 3 in-person Hill Days in Washington, D.C., allowing advocates from across the nation to engage in over 200 in-person meetings. We have also worked with members of the U.S. Congress the past 2 years to pass an official resolution to mark September 19th as National Stillbirth Prevention Day. Anyone can be an ally for change. We invite you to become involved and become a voice of the over 21,000 babies who are born still every year. Other ways to advocate for policy change surrounding stillbirth: talk about the crisis and educate for the need for change, and invite others to join you. Feel free to connect with your own lawmakers about your support of stillbirth prevention legislation, connect the dots, and work with others to strengthen partnerships that can improve outcomes and utilize evidence-based prevention programs to help save families from preventable stillbirth.
Federal stillbirth legislation has the potential to affect systemic change through the implementation of evidence-based initiatives aimed at reducing the burden of stillbirth in our country. The evidence-based stillbirth prevention program, Count the Kicks, has shown a 32% reduction in stillbirths in Iowa in the first 10 years of the campaign, where the program originated. And Iowa's African-American stillbirth rate decreased by 39% in the first 5 years of our program. The Count the Kicks program is an example of a health promotion program that can help states report back to HRSA on how they are utilizing their Title V funds to reduce stillbirth and save lives.
Count the Kicks educates expectant parents on the importance of tracking their baby's movements in the third trimester of pregnancy and to speak up if they notice a change. This proven early warning system for moms has saved lives in 36 states and 6 countries so far. In fact, we can make Count the Kicks a common practice in Arizona, like has occurred in Iowa. It is estimated that 158 babies could be safely delivered per year. I am both proud and grateful to share that Arizona is an example of a state leveraging their Title V dollars to prevent stillbirth. Thanks to our partnership with ADHS, everyone in Arizona has access to free Count the Kicks educational materials. We encourage you to order today and assure every expectant parent you serve or care about has access to this life-saving education. We invite all of you to join the effort to advocate for stillbirth prevention and educate about the importance of fetal movement monitoring with the proven evidence-based program, Count the Kicks. We also thank you for your time to learn more about the stillbirth crisis in the U.S. and how you can become involved in systemic change by educating and advocating alongside of us.